Good evening, everybody. Thank you so much for tuning into this new episode of Ellie on Point, where we go live on the Unlimited PH page and also in Biohacking Philippines. And eventually, this will end up in my podcast and my YouTube channel, Unlimited PH, and the podcast, Biohacking and Beyond. And tonight, I have a very esteemed guest, Dr. Eillen Manalang. She is a sleep medicine expert. She's a craniodontic, also pioneer here in the Philippines. And she actually teaches foreign, doctors. They come here and they learn her techniques. This is pioneering in our own country, and we have her here right now. So, Doctora, welcome. Thank you so much for being on this interview tonight.
Thank you, Ali, for inviting me.
Doctora, just quickly, can you give us a little background? Because I see, ang haba kasi ng listahan, Doctora, ng credentials. But could you just give us a brief overview of what you do and the positions here in the Philippines?
Okay, I'm Dr. Eillen Manalang. So I do Craniodontic. I founded the group. So I do more on functional dentistry. I'm a CEO, owner of Manalang Dental Group. And I used to be the consultant of some big companies. And I'm also teaching. I'm teaching dentistry, mga workshop to train dentists how to do more functional dentistry and more holistic. So we focus on function and like speaking, chewing, swallowing, and airway, especially dental sleep medicine, something that can enhance the wellness of our patient, not only just a simple aesthetic or simple procedure.
Thank you. Doctora, did you start out more of the as in conventional dentistry? And did you sort of like kind of figure out that there are more aspects to it that you wanted to
Yeah, well, I started as a simple dentist in the province for 10 years. So doon ko nakita na parang it's so boring. So as a doctor of dental medicine, parang is that it? As a dentist, parang you're just doing this and there's no some, what do you call this? There is a fulfillment. There's no fulfillment until I was able to see the TMJ pain management. And then doon ko nakita, I started to question and I started to what else can I offer as a doctor of dental medicine besides what can I offer other patient in dentistry? Like can I help them in a way? So nakita ko how there are some, etiology that are unknown. So I was thinking, could it be dental? So that led me to really do some research and study abroad.
amazing. I think parang endless student, no? You really endlessly started to really learn about these things. But then I think you also pioneered your own technique. In a way, you kind of pioneered your own method or you combined different methodologies into your own.
So for 25 years of I was really a lot of questions. So I went a lot of training and a lot of research reading and studying abroad internationally, both was in Europe and Asia. So I have a lot of good mentors and what happened is really I want to establish a concept or a concept for Filipino dentists that we don't need to spend a lot of money because being a dentist in the province, we cannot charge higher. We charge higher. So if you buy a machine, it will cost a lot for the patient. So I want to do a concept that will fit Filipino dentists at the same time. It will fit Filipino patient as well. So we were able to really, ang sabi ko nga for some, Filipino dentists are not aware para tayong nakahukay ng ginto or uh, oil that they never realize the technique that we are now doing. Other countries are not doing it. The precision of it, sabi ko, we tested it, I tested it along with the big company like the GOC Metro Dental. We tested it and we find it 95% uh, uh, according to one of my colleagues that 95% is almost successful in our treatment, complex cases. So it's like we were able to develop it as a Filipino.
Wow.
Or in other countries, like you need to have a lot of machine for you to do that. Well, this is so easy for us to see. That's how Filipino dentists talagang sabi ko, I'm really proud of us being Filipino kasi we can do it in the easiest way. We can develop our own.
Amazing. I love that. And Doctor, what would a complex case be? What is considered complex?
Complex case is the most complex case is full mouth rehab, wherein we need to do some crowns, lahat talaga is alteration. And the thing in sa dentistry, predictability. Yung success mo, well, the way, I don't know, the training, parang hula. We are not 100% sure of what we're doing kasi we are not that deep in terms of occlusion, micro architecture, measurement. So we don't have machines before. So walang nag-train sa atin sa Filipinas like electromyography, jaw tracking device. We do not have that. So the predictability, kakulangan ng information as well. So medyo madami. But now, because of this generation, everything is measured. And so now the predictability and precision is possible.
Nice. So what would the difference be, Doctora, if somebody had, let's say, a root canal issue or let's say an implant, and then what would the difference be that the conventional dentist would look at versus your group, the craniodontic group?
Yeah.
What would you look for or ask what?
Siguro like sa amin kasi, we want to know the root cause of it. Like kunwari, yung na-root canal, sometimes there are some cases na narurot canal na hindi naman sira. Right? Hindi, walang caries, so how come magkakaroon ng infection yun? Walang caries, walang infection. So sa amin, we're going to look at the cause. It could be airway related, that is why they have this bruxism na possible, or it could be traumatic occlusion because of the avoidance, like uh, a bit of miscalculation of the alignment of the teeth. The brain will notice that, and there will be some avoidance. So magkakaroon ng avoidance during movement like chewing, speaking. So there will be some avoidance kahit na microns lang that can cause necrosis of the pulp, and some dentists do root canals. So sabi ko, why will you do that? It's still going to fail. Kasi you need to know the root cause like airway or a lot of anxiety. So we need to know anong root cause. It could be caries, but not all is caries.
Right. So it can be emotional rin, no?
Can
Doctor?
be
A
also.
lot of it.
Yeah.
Yeah. Actually, in a practice that I'm trying to teach here in the Philippines, can manage kunde, we know that bruxism or anything to do with the jaw is it's sort of like an anger because the jaw in the animal kingdom you use the jaw to bite or to defend oneself to protect from. But in humans we don't consume the bite, so to speak, because it's a figurative bite, diba? So we don't really we wanna bite the person because we're angry, but we don't really literally bite them. So it's a frozen bite. And then at night, that bite heals itself by coming out and then processing itself. So
So
that's
it's going to do some bruxism. Yeah. According to
yeah.
Dr. Slavicek, one of my mentors in Vienna, the mouth is and even in craniosacral therapy, it's an avenue of expression. So it's an avenue of expression, and it's bruxism. Sometimes it's not bad because it could be something that you release. Sometimes it's an airway, but not all is airway. Like could be your emotions. It's trying to heal itself. Kaya you brooks. That's my point is the bruxism is not bad, could be healing of the body, but we need to, as a dentist, we need to learn that we call it parafunctional to cause some avoidance. Like when you do bruxism, there is protrusive or sideways bruxism. So the dentist can design that movement to protect the system because it's a healing as well. So there is such thing as anterior guidance and canine guidance. Those are movement during bruxism to really protect the soft tissue, the TMJ, the teeth as well. So kasi it's healing. Tama yun, it's a healing. Yeah.
It's interesting.
Yeah.
But also, Doctora, what is the connection between craniofacial TMJ health and also airway and sleep? All of those na you would not expect, no, when if you go to a dentist's office, you would not expect someone except of course for TMJ, but still if not all offices specialize in TMJ disorders as well. So what are your findings on the connections among all of that?
The cranius, the cranium, craniofacial, from craniofacial, actually they are one, they work as one. Because if the cranium and the mandible is not aligned, so the DMJ is out of alignment as well, the airway is affected as well. So the system is created to be aligned. The upper jaw, the cranium should be aligned with the mandible. If not, and the hardest part of this for dentists is the jaw is not aligned in just for midline. It is in a 3D dimension. Sometimes it's a 6 dimension alignment. So if it's not, it's going to really trigger the TMJ. It can even cause muscle disorders at the same times airway that will lead into problem like dental sleep medicine or hypopnea during or even hyperventilation during daytime. So a lot.
The mandible is this lower part of the
The
jaw,
lower part of the jaw, yeah, the lower part of the skull. Yeah.
lower part of the skull. And this is the TMJ is the only joint here in the
Yeah, that connect your cranium to your joint, to your mandible through your joint.
yeah. And see what's interesting with Doctora in the clinic. I went, I see John and then Doctora is there. And I had myself, checked for like I had a stent because John found that I had teeth that were abraded. I guess over time maybe I had bruxism. So okay, I was in my childhood I had bruxism. Maybe I wanted to answer back to my parents and I wasn't allowed to. And in my dreams, in my sleep, I answer back in the form of bruxism, diba? So that can cause abrasions. So my teeth are abraded, meaning when I bite, it's not a full bite kasi wala na. There's no contact anymore. So over time, I guess, could that also cause TMJ, Doctora, because it's kind of not aligned
Yeah, yeah.
anymore?
The abrasion. Oh, yeah. Number one, the teeth is not aligned. So it's the analogy of that is like a machine. You have a joint, diba? In mechanical engineering, you have a joint. So you have a gear. If your gear are not aligned, the joint won't work properly. So after few years, talagang masisira siya like a car, right? Then in a car, in automotive, you have this alignment or something.
Yeah.
Dapat align
And
siya.
what I love, this is really interesting, guys. I don't know. People might find it woo-woo, but it's not eh. And I use this in my practice. No, it's kinesiology. I use it in something called psychology, kinesiology, and Nambudipad's allergy elimination technique, where we do muscle testing. And this is adapted from applied kinesiology. You do muscle testing,
A
diba?
lot, a lot. We
Yeah.
do a lot of muscle testing in our clinic. From the arms to your cervical to your pelvic muscle to your leg muscle, we test that with our
Yes.
dental procedure because we need to be sure that we won't be the cause of the problem of the patient. We don't want to
Right.
be the cause.
Yeah, so amazing. How did you kind of link applied kinesiology with craniodentistry and
So
mechanical work?
when I started to do TMJ, so we are exposed like being trained with chiropractors by Dr. Robert Walker, the work of Dr. Gerald Smith, wherein they do trained by PTs, osteopath, and chiropractors. So
Uh,
this mentor of mine, which is have most of the guru of craniofacial pain management are in American Academy of Craniofacial Pain group. So they do a lot of muscle tests. So they work with PTs, they work with osteopaths, they work with chiropractors, and all of these guys are doing applied kinesiology. For us dentists, like, so in abroad, like, okay, what is this? It's really something for us, like, it's weird for a dentist because it's not being taught in our field of dentistry. But when I was exposed, like, who cares as long as it works, right? But for me to test, why not? Yeah, and I see the most accurate test analysis is applied kinesiology than having a machine.
it
That is
is.
so
Yeah,
expensive. I have a machine, I have CBCT that cost me 10 million. The applied kinesiology is free and it's more accurate than a CBCT.
it
Yeah.
is. Yeah. So if you guys are wondering what muscle testing is, so it's kind of like that practice where you put your arm in front and then you try to resist, and if it's strong, then you're resonant with whatever you're testing, and if it's weak, then you're not resonant with whatever you're testing, or the body is rejecting it.
And
So
you
it's
are
kind of
practicing that. Yeah, right, Ellie? That is your group is really into applied kinesiology, right? Nice for us. So nice for dentists to hear that your group are into applied kinesiology. So we are not the only one who's doing it. You are more expert than us as a dentist. Yes.
yeah. And it's so cool because you can apply it in your daily life. For example, if you want to see if this person if you like this person or not. You can actually muscle test. Do I have subconscious distress to this person in front of me? Yes or no? Is this person a good, or should I avoid them right now? Yes or no? And even food in the grocery. So you put it against your body and see if does your body move forward or backward from it. Then you know that maybe it's not resonant right now.
So that's nice because I hope a lot of dentists listening right now. I hope they are hearing you now right now. Like I'm not the crazy one. Eddie knows everything about this. Yeah, I'm
Yeah.
not the one. See?
It's so amazing. I use it in the NAET, and then I also follow the work of this guy Jerry Tennant. He's an ophthalmologist, and he is the author of the series of books called "Healing is Voltage." And so he says
Ophthalmologist?
he's an ophthalmologist, yeah. And then he has all of these gadgets. But he wrote a series of books called Healing is Voltage. So it talks all about the energetic body, the bioenergetic field. It talks about Eileen
Mm,
McCusick using sound. He has his own gadgets, the photobiomodulator, which I use every single day, and things like that. And he talks about teeth doctoras. Teeth are like a
he's talking
magnetic
about
field. They hold emotions. They are magnetic fields that are all connected to our organs. So we know that. So he has ways of muscle testing each organ
it's in his
meridian.
book. I need to read that.
Yeah, healing is voltage and dami. And then he has one on specifically on cancer and the kind of the level of voltage that all our cells need to have, which is negative charge minus 25 volts, in order for it to start repairing. So it's interesting, but he does muscle testing also, and then we use his gadget to put voltage into that meridian so that the body will start to rejuvenate itself, will start to have a battery flow. So he uses those gadgets also, but the teeth are so important. So we put the gadget in the teeth, doctora, and
In the
sometimes
tea?
yeah,
Really?
here sa labas, it's like the ray, and then there's a transducer. So it's a bio transducer. It puts the voltage into the teeth, each tooth, so that the flow will go through. Because if there's a particular tooth that's not holding charge, then the circuitry will be
Oh,
blocked. So
interesting.
this one kind of pushes it. And then we put it also in the TMJ. So in the TMJ, we put the biotransducer there, and then it goes through the whole meridian system, both sides, and then into the belly button as well.
That's interesting. I have one mentor kaya siguro sabi niya, the teeth is like a circuit breaker. Like I don't understand. Like okay, it's like a circuit breaker. So probably they know it already. They know that every single tooth has some meridians actually. That is
Yeah,
responding to every organs like the canine of the upper canine is responsible for the meridians of the stomach. Like
right. Yeah. The front teeth are kidney. And then what's the
mm,
yin and yang?
yeah, but
I forgot na. And then stomach.
every tooth has its corresponding. I met a guy, a chiropractor. Every tooth has a corresponding muscle. Like the upper are for the upper extremities, the lower teeth are for the lower extremities. So you have extracted teeth on the lower, so that's the reason why your lower extremities are more weaker than the upper, like the arms or something. So that's why
Yeah.
I started to ask my patient, so you don't have a lower more. So is your legs like they're saying like yes, wow, that's accurate.
Yeah,
Then I
because
started to ask them, yeah. And sabi ko, wow, these people have a lot. So for us a dentist, like a lot of things to learn. Yeah.
yeah. And maybe I think maybe a part of that is because in our evolution in the primordial sea billions of years ago, we actually started as ring-like structures or ring-like organisms where we were just a circle. So there was just an opening for eating and an opening for pooping. So parang that rupture is actually our mouth. So parang we were kind of connected in some way. So we don't see it as upright beings, but if we were to actually form a circle, they would all connect together.
Yeah, it could be something, right? You're talking about circle. I'm wondering because I do dental engineering. What I'm saying, like, every time you open your mouth, it's a radius. It's 45 degrees. So in a circle, it's one fourth of a circle. When you open it to maximum, that is 45 degrees, and that is a radius. So it's a one fourth of a circle. So everything like I study a lot about envelope of function, wherein we talk about envelope of function of speech and chewing. You know that is or elliptical. So every elliptical, your arc should be elliptical or else you cannot function. You are talking about circle. And I'm really wondering, everything is circle and parallelism, everything. That's how God created architecture, like how perfect it is.
It's so amazing. Yeah,
And
so
talking about circle, like, yeah, I'm wondering also why it's everything is circle.
parang we're connecting everything, no?
And yeah, that's why I was surprised when you're talking about the circle. Like, okay, I
Yeah.
didn't know anything about circle because I'm really wondering every time I do some analysis. I heard about the work of Casey Gusay, and he did the envelope of function, everything that is dental, and it's circle or the golden ratio, the spiral golden ratio is
Yeah.
also like, I don't know, so amazing.
We're touching on different paradigms na like,
Yeah, yeah.
like
But
metaphysical, also
yeah.
cosmic, universal.
Everybody's there. I think some people have been researching about that. It's just so happened now they are now being connected.
Yeah, which is good because there really is no separation because that's a huge part of how we are as human beings as well. The seen and the unseen. So it's what I really loved about visiting Doctor the other day is that I make palagay a stent because I have teeth that are braided. So my bite is talagang it's not
Split.
complete. So I had the splint. And so the splint is here, it's palliative and it's helping me bite a little bit more.
How is it now? Why is it? We placed it like 2 days ago. 2 days
Yeah.
yesterday. Yeah. How is it?
So amazing. No,
How's your sleep? How's your sleep now?
my sleep has always been amazing, Doctor. Because it's the number one, aspect of health that I really am obsessed with.
Yeah.
So it's really, really amazing. So it's still really good. Still
How
really
about with your splint? When you place the splint, so does it have any is there any changes sa pakiramdam mo or something when we place?
So far, it's only been one night, so I haven't really felt any because my sleep is already really good. So
Okay.
I'll give myself mga 7 days to see if there's a difference or anything.
Because you're so relaxed, because you have machine to
So by machine, feedback, heart math,
you have those, or probably you do some yoga or something. If you're relaxed, your body can adapt. Yeah, probably. That's the thing I'm saying.
So it helps a lot, but I'm sure there will be. But the thing that I'm noticing is that I feel more stable in my body. I'm also sharper. I'm usually sharper. I just feel so much more focused with a complete bite. I don't know if it's me or anything, but maybe it's because the
I
TMJ.
posted 2 days. You're talking about, it's so amazing. You're talking about focus. I just placed a stories a few days ago, like chewing can cause, so biting can cause more attention. That's the attention span. I just posted yesterday that
Yeah.
the chewing can enhance the comprehension and the brain when your teeth touches. That's so amazing. You just said that.
Yeah, yeah. I know that's what I felt. I get a little bit distracted, not too much, but sometimes I drift here and there. But today I felt just so focused, and I don't know if that has something to do with the TMJ. Not
With your bite,
great.
with your bite. Could
Parang
be your bite because of the splint can not only the jaw, but we are talking about when you bite on it. We were talking a while ago before we went live, right? We're talking about the bite and how it can cause when you have a distribution of load or bite, because the splint just balance your bite literally. So once your bite is balanced, it can enhance the cranial movement. It can enhance the flow of your cerebrospinal fluid, because now when you bite, it's so balanced, like, so it enhance your cranial movement because of that. It could have enhances the flow of your cerebrospinal fluid. Yeah.
nice. Yeah, and maybe also it also lessens maybe the pressure on the trigeminal
Yes.
nerve.
Yeah, blood flow.
So
Little,
yeah, but I'm sure a lot of people, don't even know about this. That they don't even
they are a lot.
or even want to believe that the teeth holds such a big place in holistic health, and it's like it's the only thing maybe that you're not looking at. That's the missing link towards you optimizing yourself, brain and body is here, right here, the teeth, which is connected to the cranium, EMJ, and even the cervical spine, and thus it's connected to everything else. Yeah.
And it's amazing for me to hear your group, like in biohacking. You have the guy you mentioned, the medical doctors doing osteopathic craniosacral. It's like I am looking forward to meet him. I'm looking forward to hear him and to talk about him, how the dentist is sometimes could be the culprit of everything, and part of it we have a big part in that cranial distortion. So it's so nice for to talk to a medical doctor specialized in craniosacral.
I think it's Dr. Ferdinand Bronner that we're talking about.
Yeah, I love to talk to him.
There's also another myofascial therapist, also Amiel Ferrer, who is also doing cranio, who also studied CST with Dr. Bronner.
We have also I heard somebody one of my patients talking about a chiropractor. One of my patient that I encountered from Alabang, she has this chiropractor, and then they did some I don't know some therapy to her, and then she's saying, "Who's your dentist?" It's my first time to do a therapy to one patient who have a normal rhythm. Like, okay, so just tell your chiropractor I'm an osteopath. That's why I know the rhythm. So he was so amazed. It's my first time to encounter an orthodontic patient whose cranial rhythm is relaxed. Of course, I know that because I'm osteopath as well. I will ask the name of the chiropractor. Probably you can also invite him on this on your podcast. It's I was actually to have a schedule to talk to that chiropractor, but I don't have time.
But what I wanted to say also, because I recently got this splint and we did muscle testing.
Hmm.
So John tested me for with and without the splint. And the splint kasi completes the bite, or the bite becomes stabilized or balanced. And the muscle testing without the splint, it was weak. I could not resist.
Yes, I tested your cervical muscle, cervical 1-7.
Yeah. And then when I wore the splint, wow, it's really malakas. Whatever muscle test, it was so strong. So that means that that there was a missing link. There was a part of my biology that I was not addressing, that I was vulnerable to.
That's amazing. You're talking about your biology that you know that when we did a split and I tested you that because you are so involved with applied kinesiology, that's how deep you know. So you know that if you're stronger with your muscle test, there's something happened with your biology that your body really wants that splint because it's so amazing for you to say that. I hope that all of the dentists who are now logged into your live podcast, you know, Ellie's not a dentist, guys, and the applied kinesiology is for you to check your bite if it's okay. So I hope you heard her talking about the biology, how the biology of first system is more balanced once you did an applied kinesiology. That's how you check your bite. Yeah. Yes, I'll check your bite in any procedure. Dentists are so involved with bite every time they do denture thing. Everything in the dentist is about the bite. So applied kinesiology for you to test the bite if it's correct or not. How much will it take for you to do applied kinesiology? It's free. What I'm saying, Ellie, sometimes a bit this technique works, right? It works really. But the acceptance of the dentist is the problem. I don't know if what will you call it is an attitude or the character or whatever. Everything is working, but the acceptance. Why is it they cannot accept it? Like
Yeah, kasi the
even have a machine. I did an electromyography with that. So, but still skeptic, guys.
parang no need na eh. Kasi parang, it's like pre the modern medicine era, we were largely animistic. I mean, the ancients trusted the body, and that's all they knew. They had no choice kasi wala silang machines. So they studied how the body, the bioenergetic field works, and how the systems communicate with each other. That was the only way we knew how. And somehow they didn't need machines to understand what the body was, because it is a machine and it knows everything. And remember, we were talking before the podcast or the interview started, was that there's this cellular intelligence that all life everywhere kind of stores all the information about everything, lived experiences in the morphogenetic field. And it's a resource that we can all, go into. And it's like I had this podcast interview with the maker of my pulse electromagnetic fields, Matt, and he is into biophysics. He's been into the biofield of the humans for so long, and he calls it actually homeodynamics. The biofield. And it's like chaos is the highest point of existence because it already knows what it will be. So if a baby is, or let's say a seed, you plant a seed into the soil, it already knows what exactly how it will form into what kind of tree, exactly what species and things of that nature. So there's already an intelligence that's automatic that doesn't need to any feeding at all whatsoever, doesn't need to be
Already,
built
it's already
because it's
designed.
designed. There's already a divine blueprint, which
Right?
it just needs to express itself in the 3D.
Exactly.
That's all.
Yeah.
And so parang that's what our biology is made of. I mean, this is
It's
like
made,
the highest
is that
form
what you
of
call
evolution
also
on the
now?
planet.
Is that what you call now epigenetic as well? This is my
Meta epigenetic.
because there is epigenetic also in dentistry, right? Like you are all developed to be in normal, and you have the potential to be in normal. So the dentist just need to trigger or stimulate that normal, see that to be normal, but you still have the genes to be normal. So you do not accept na because if it's my genes, it's only 35% it's in your genes. The rest it's epigenetically driven, or
Right.
the nature's designs for you to be in normal, because we are created in his likeness and image.
So Bruce Lipton said epigenetics, genes load the gun, but environment pulls the trigger. So if you have two, a set of two, a pair of twins, and you put them in different places and they have different experiences and they have different beliefs around their biology and practices as well, you put them back together after 25 years, they don't look identical anymore. They look
Yeah,
completely.
yeah.
So
Is
even
it
if they
interesting?
start out with with a duplicated blueprint, put them outside epigenetics,
Oh,
it influences
yeah.
how they are. They don't look
Amazing.
exactly the same anymore.
In the environmental.
Yeah, that's
That's
the
nice.
interesting part of it.
Yes, it's interesting that you know very well on that. Like it's amazing because in dentistry we are just like, if you're going to talk about that in dentistry, especially in the Philippines, like they are not into that because it's not in the book. But what I'm saying, the book we're reading is outdated. It is
With
outdated. It's amazing
Pero
for you to talk about that.
can people do their own muscle testing, even your bite and everything?
Yes, you can still on your own. You can test your bite. Yeah. Sometimes I teach my patient, if you think you can test your bite, if you can, or my some of my student dentists,
Oh,
Craniodontics, yeah, in teaching them, you can test your bite, so you can even
yeah.
treat yourself.
Yeah. Except of course, if you do it yourself, there's
Yeah,
the
you
risk
get
of
the
conscious mind manipulating
yeah.
the answer, diba? So sometimes it's better to have a practitioner out there. So I wanted to talk about airway, Doctora. Can you talk to us about airway? Because nobody knows about airway.
Mm.
Basically, people think, okay, I'm new. I am a nasal breather, do buteyko breathing. I do mewing and everything. My airway is perfect. But actually, when I had my airway checked, my airway was very far from it. I had so much obstruction. So can you talk to us about airway, Doctora?
Okay, airway. Because of airway, we are not aware that we are obstructed because of the we are used to it, so our body's numb. So some of the patient that I have, like they started to be their airways really bad. They started from young to adult. So now being adult, of course, your mind is used to it. So you never know that you have a problem. So you numb yourself on that breathing. So you're already used to it, but actually the body should not be breathing that way. And
Yeah.
some of the airway, I was trained as a dental sleep medicine, but when I started to do TMJ as a patient, I'm a TMJ patient, but I don't have a problem on the jaw. I don't have pain on my jaw. I don't have a clicking jaw. I never thought it's about the breathing because I have asthma, I have allergies. So when I place the splint, I started to observe that I am having nightmares before. I have numbness during sleeping and nightmares. I never thought it's about my breathing. So when I started to place the splint, especially of my work, I'm so tired. I have 50 patients a day when I was in the province. So I never thought I have a breathing problem. Nobody's educated us how to breathe. It's so amazing that you know that you should be breathing in your nose. But when I started to study airway like 35 years ago, I never thought that you should be breathing in the nose. So I started to breathe through my mouth because I thought, oh, I'm going to have a lot of oxygen if I breathe on the mouth. So nobody has taught us that you should be breathing through your nose and not through the mouth. So I started to really breathe on the mouth, and it worsened my allergic rhinitis and my asthma. And what I see when I started to use a splint, That's the reason why it drive me to study abroad, because it's not that's the reason why, like, it's not about the TMJ. The TMJ is just a part of it. You can survive with your clicking jaw. You can survive with your painful jaw, but you cannot survive without breathing. In 10 seconds, you cannot. You can survive. You can even survive without eating the whole day, but not
Yeah.
for you to breathe in 1 minute. You're going to have cardiac arrest. So when I started to place my splint, I realized my problem is not TMJ because I never had that. My problem is about airway. And that started my journey, like, and my immune system started to improve. My sleep started to improve. My mind, my brain started to work. Like, my emotion, my temper started to improve. So I started to something about the airway and the mouth. So that's the thing, because the way you bite should be in a normal physiology. That's why I'm saying that the jaw can be distorted in 6 ways. And if the jaw is distorted in 1, 2 ways, it can really distort the airway. That's a big part of it. It's not that splint with the jaw. It's about the airway. And it's like I heard one mentor, like, if you have a 6 lanes and you 3 lanes and you add 1 lane, just few millimeter, it is a big time in your brain and your system. Yes, that's the thing. That's why the splint is not just for the jaw to balance. It has a lot of benefit, like it balance your jaw, it balance your bite, it enhances your cranial motion, that improve the circulation of your cerebrospinal fluid, it improve your breathing, it improve your immune system and everything. So that's about airway. It's plus, in as a dentist, we can improve. Like, we as a dentist can do the epigenetic development. We could be the environment of your child. Like, if your child it was growing with a bottle feeding or something, the bone is underdeveloped, the dentist could be the epigenetic. We could drive that bone to grow for that
Wow.
person to have a bigger airway. Or even a
Wow.
danger, like, you did not polish it. You have a big teeth, should be small teeth. Don't you think you restricted that area? How can the tongue be? And because you did not know the dimension of the teeth, you're just guessing. How really I have realized as a dentist, I have a big part in knowing that. And us dentists, we are not aware of the thing that can have a
Yeah.
negative or positive effect on our patient.
Yeah. Doctora, how did you grow? Because I know, like with Lesson A Prize and the indigenous worldview, the
Mm.
indigenous communities, they really breastfed their children up to 4 years old if it's a boy, 7 years old. And a lot of that is because the suckling motion also develops the jaw and then widens the jawbone, diba? So that it can accommodate all the way up to the
Yeah.
third molar, the wisdom teeth. And that's why Weston Price found that the tribes people, they didn't have braces or need them because the jaw could accommodate all the teeth and they were perfectly straight. But I heard you say that you can grow. How do you
Because,
grow? How does a dentist grow the jawbone?
well, when I started, when can a dentist can intervene your patient? As the work of, I read the book of Western Price. I've been doing the Western Price. When will a dentist intervene? So you can intervene as a dentist once you have patient who is pregnant. You can educate, right? If that mother is not eating properly, the nutrients is not enough, that mandible, that jaw of that baby inside, it won't develop. So immediately in the womb of the mother, you have already triggered the thumb sucking habit, so that can trigger the development of the bone of that child in the womb itself. So that's
Oh,
the
wow.
first stage, and then once they started to have that underdeveloped bone, the dentist can develop by doing some orthopedic appliance, something that can trigger the development of the bone, or we can even intervene by development or improving the swallowing pattern. So even in adult, that's a thing that some dentists are too skeptic about it. That they thought Ellie that the bone of the skull doesn't move. If the skull of the head is not moving, why is it we have osteopaths, right?
Yeah,
The
yeah.
osteopath and the chiropractor maneuver the skull. That includes the palate, right? They do the palate
Correct.
maneuver. So
Yeah.
how come they're doing that? They're expanding it manually. So us
Yeah.
dentists, we have the power to develop the mouth, the bone. So no medical doctors can expand the skull. Only the dentist.
Wow.
Even in adult, yeah.
And that's why we have sutures. Is it that
Exactly.
they kind of move around and
It's moving.
yeah, it's
And in
moving.
between that sutures, you have stem cells.
Okay.
In
Wow.
between the sutures of the skull, we have stem cells. So it never grow old, it never been fixed because we have stem cells. Because if you
Mhm.
study the enlo, the growth and development, you should know the what part of it it's what kind of growth. Like is it endochondral and intramembranous? So it's science. There's a reason.
Yeah. Amazing. And I know the sutures or the cranium will harden if you have to bite or fight or whatever. It will kind of
Because of the
harden
muscle.
to protect the skull, to protect the head if you're in a fight or something. If you're in like a fight
I
stance or
don't
something.
know.
Yeah, it will protect
And
the
then you
cranium.
bite on the teeth, right?
Then you bite on the teeth. Yeah. So it's
Bite
all connected lahat.
on the teeth if you have the teeth.
Right.
But if you don't have teeth, yeah, that's why like doc my there are some patients, doc, I feel so tired because you do not have a teeth to bite on. That's why
Right.
your jaw is hanging. It doesn't have any rest. So you need to swallow. The purpose of swallowing and touching your teeth is like para sumasandal ka once in a while to rest your muscle. That's why you're tired. You never rested.
Yeah, it's because maybe the trigeminal nerve is also giving information that there is some sort of distress.
Yeah, you need
The
you
nervous
plus
system is
you need
distressed.
to touch. That's why you swallow 2,500 times a day in a day, 2,500 in the night. So you swallow your saliva. So every time you do that, you're rested. So that's the reason why some patients have a lot of migraines. They're touching this. That's a muscle of mastication. That's are the muscle that closes your mouth, but you don't have something like poste. You don't have something here. That's why all of these muscles are tired. So that's why you have migraines.
Yeah, it's all
Uh,
connected, and people
yeah.
don't even know to look at the mouth, for health.
Yeah,
Yeah,
they plus the fact they ignored the teeth. They ignored the
yeah,
teeth. God created the teeth to be the hardest. And if you're going to think about it, why God is not stupid to make the teeth hardest.
yeah. It's like our diamonds there, diba? Heart
They
of
are like
diamond.
diamonds. Every details of it, every grooves, every shape. I was doing a wax mock-up a while ago. I almost forgot about our podcast. Like I'm doing a wax mock-up. That's what I'm saying, telling you, Ellie, like, wow, how detailed God created the teeth, and it's so
Yeah,
amazing. You cannot make mistakes.
yeah,
Only dentist, yeah, I started to use microscope like, wow, if only I know how detailed the teeth is, I could have been an architect or fine arts or something. I don't want to be a dentist so small. I gotta see. It's so detailed.
yeah. Doctor, what about snoring? There's so many people that are snoring.
Oh,
Can the splint
okay.
help with that? The
Snoring,
airway?
yeah, snoring could be a lot of factor. Like it could be aging because of the collapse of your soft tissue, your muscle, or it could be airway. It could be obstruction of your nose, tonsil. So there are a lot of cause of snoring. Could be the jaws protruded, the jaw are smaller, or could be nasal polyp, nasal depth. So we have a lot of possible cause of snoring. The ovule is big, pharyngeal muscle are loose. So, but that doesn't mean it's a sign of a sleep apnea. So especially men who are in age like 50, 60, snoring is normal. Or people who have allergic rhinitis or something, snoring is normal as long as it doesn't cause any obstruction of airway. But it doesn't mean you have a problem during snoring. It could be nasal snoring, could be a mouth
Yeah.
snoring. Sometimes we need to work with ENT as well. It's not something that it can cause dryness of the mouth because you're breathing on the mouth.
Yeah,
That
yeah,
could be, yeah, that will be the adverse effect of it.
yeah. And nothing about the mouth is made for breathing. Nothing about it.
Mhm.
There's tongue and teeth and enzymes and like
Yeah, the
the
enzymes
the
will
oral
be.
mucosa is like the intestinal mucosa. There's nothing about it
Mhm.
that's made for breathing. It's made for chewing and digesting. That's
Uh,
it, because it was part of the intestines when we were like a round object. It was just kind of part of that. But
and
the
then
nose
amazing when you're
is
talking about the enzyme, it's really something.
digestive enzymes. Yeah, and the nose is for breathing because there's nitric oxide, but the gas
Yeah,
through the
exactly.
mucosa
Nitric
and
oxide.
the oxygen that. And would you say, Doctora, that when people get the splint and then it improves their airway, there's better
Yeah,
oxygenation?
since you mentioned about that, the splint, because it's like, of course, if they wear a splint, they try to bite on the splint and then they seal their
Yeah.
mouth. Actually, that's training for them to breathe through the nose. So they are not aware of it. They started to breathe through your nose because you keep on your mouth biting. They keep on biting on that splint, and that they are not aware that they're keeping their mouth sealed. Now they
Yeah.
started to breathe through the nose. And right, exactly. The nitric oxide can improve the benefit of having nitric oxide. It's like vasodilator, right? Those the
Yes.
major organ needs a nitric oxide.
Yes, and bronchodilator. Yes. Yes.
Oh, yeah.
Molecule of the year 1992. That's nitric oxide. Yeah.
Wow. Wow.
So likely it's because of the oxygen. A lot of people because they are not functioning so well because there's so much oxygen debt. So the organs are not getting enough oxygen. So it's just waiting there. Can we please have oxygen so that we have energy to complete whatever biological process we need to now process. And so when the airway is improved, there's more oxygenation in the blood that gets transferred. And then, the organs and
Yeah,
the
it's so
functions can
easy because
finally finish the repair.
yeah, some of my students are even making a joke out of our splint. We could make our splint oxygenated splint. Yeah, like let's make blue and call it oxygenated splint because the air is improving. Yeah, we call it oxygenated splint. That tried me also, Ellie, when I started to wear splint. I started to observe when I was in Tarlac, I was not yet still a consultant in Manila. I started to observe most of my patients, 95% then, 95%. They breathe through their mouth. They are not aware that the nose should be.
Oh.
95% of my patient doesn't breathe through the nose. So all of them are airway problem. That made me realize it's not about the jaw. It's about the breathing. So 95%, way back, that was 25 years ago. You don't breathe through your nose. All of the people now is breathing through the mouth. Like that was 25 years ago. I've observed. Ask them like, how do I know they breathe through their mouth? I always ask them, where do you place your tongue? It's always anywhere. It should be at the
Yeah.
polyp. Everyone doesn't even know that the tongue should be on the top. And I was really amazed of some dentists like, how many hours? I have a student dentist like, Doc, how many hours will I place the tongue up? Depends if you want to breathe. Okay. Like you want to breathe like 3 hours, so you place it 3 hours. Like you should be placing it 24 hours, right? Yeah. They are not aware of it. Dentists.
Yeah.
So they are not aware about the position of the tongue.
Isn't that interesting? That's so interesting. Biohackers, we know about
You
we're all into nasal breathing and all nose breathing
I was right now thinking like how many years the biohacking started?
since 2012. Doctora.
Oh, so yeah, because of it's amazing. Sometimes, digital sometimes could be good because now you are spreading this information
Yes, yes, yes.
into 12, right?
There's this beautiful book by James Nestor called Breath, and he talks about all of these different, even the ancient ways of breathing, the Tibetan tumo, and mewing. So mewing
Doing and
also
we call it what do you call the type of breathing? It's a Japanese
buteyko.
buteyko technique. Yeah, yeah, buteyko
It's
technique.
Russian, but it sounds Japanese nga. Yeah.
Oh, it's a Russia. So yeah, I thought it's a Japanese because I was reading about that. What is buteyko technique? Yeah.
Doctora, guess what? In the Philippines, again, Filipinas pride. Okay, the medical advisor to the world expert of Buteco breathing, Patrick Macianus, who is in the UK, his medical advisor is Filipino, and he is based. He has written 3 books, I believe, on Buteco breathing. His name is Dr. Charles Edward Florendo. Dr. Charles,
Wow.
was on a
Right.
podcast, and he
I'm looking forward if you're going to have a
online and in person.
Ah,
Yeah, we already had one.
we can share me the link because I can share it to to my group. Take this technique really good.
Yes, he's also a doctor. He's a family doctor, and then he teaches online and in person. He teaches, of course, asthma, sleep apnea sometimes, but general wellness. So I think you and him should really work together, have workshops about this. He could teach your dentists would make a
We can
breathing
work
kasi-
together, but take a technique because even if one thing that I always also observed as a dentist, like we did an appliance, but the patient is still breathing on the mouth. So how can we, right? And then the appliance will shrink again, even if when the patient started to remove the appliance, the jaw again started to become smaller because they're still not breathing properly. And or
Yeah.
I heard one of my patient did a surgery. Patient have a sleep apnea. They did a pharyngeal soft tissue surgery to make the airway bigger. And then I was surprised the patient still breathing through the mouth. Like, did your medical doctor taught you how to breathe in the no doc, like wow. Like they did surgery, you didn't inform the patient to breathe through the nose, still breathing through the mouth. So what's the use of it? Yeah, that's the thing. So a lot of
Oh,
Yeah, yeah, it's really good you're having this podcast, Ellie, because there are a lot of people should be educated.
yes. These things they can already do, Doctora, like Buteyko breathers. Like, it healed my asthma in 2014. And
Yeah,
then
yeah,
also my allergy to dogs. And I
yeah.
was allergic since I was 7 years old. I
Acidity,
did
right?
Buteyko na nawala.
Acidity of the body, if you breathe properly, the body goes into acid. When I was into airway, but nobody's talking about airway then. I just, well, I just use the TMJ for doing some workshop because that's the layman, the dentist knows TMJ. But I'm actually into focus about airway. But I wasn't talking about airway because it's like, why are you talking about airway? Nothing to do with dentistry. Okay, let's just talk about TMJ. Okay, but there's already airway, dental sleep medicine. I'm doing osteopathic technique. They're saying, why are you doing this is not for dentistry? Like now, after 20 years, everybody's saying, this is that. But the thing is, why I am focused into airway when I was still in the province 25 years ago, I've observed that most of my patients have acidity that are prone with a CA. But
Ah,
I was not talking about it like, nope, sip your mouth. No, 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 no. So I cannot talk about it. But it's about having the common we need to be more breathing through the nose to make our body more in a neutral balance, right? In the chemistry of the body. The thing is like the growth of tumor cell is more prone with patients who are mouth breather because their body is acidic. Am I correct, Ellie? That's the main goal, and it's a big problem now,
yeah.
especially now. So good thing now after the pandemic, everyone is really into more wellness and
Good.
happy with your group. Yeah, really.
Yeah, I'm happy about that too. Yeah, and I love it that that your practice it's Filipino and it's not about making money. It's about helping humanity. Those
Yes,
first,
yeah.
of course. If we can help every Filipino with whatever nuggets
Not
of it.
costing a lot of money, right? It's not about
Yes,
money. It's just need to breathe through your nose.
breathing through your nose. So what would you do, Doctor? Like Buteyko, we tape our mouths at night so that we
Well,
breathe through
for
our nose.
me, taping the mouth, yeah, you need to be aware that sometimes you have polyp on the nose. We have nasal septum deviation. The mouth is also a backup system for you to breathe if you have obstruction of nasal.
Yes,
So
yes,
taping the mouth, it should be screen first. If you have big tonsils, you cannot tape the mouth because you need to breathe through the nose. Because I have this training, a residency in Boston then with Tufts University. So I did we are assigned to send a one patient with an appliance for sleep appliance. So I did send one of my patient with sleep apnea with an appliance. And I was really aware of, I'm really questioning the teacher why is it my patient have a incident of hypopnea and then suddenly develop an apnea when I place my appliance? And he said that you could have done a two appliance that separate because sometimes your patient need to tongue thrust. They need to tongue thrust and open the mouth because it's a backup system. So we need to be careful in taping the mouth because we need
right.
to be aware if taping the mouth is good if we have the habit of mouth breathing only. We have the habit because we are
Yeah,
trained. But if there is an obstruction that we need to breathe through the mouth, so should be really screened and you should be working with the ENT as well because
right,
that's another part that we're in which it shouldn't be we just don't tape it unless we don't have any obstruction of the nasal.
right. Good point. Yeah, and usually in Buteyko, we teach first how to hold your breath. Well, over
Yeah,
time, like maybe a couple weeks of practicing that before you even try to tape your mouth, you have to be comfortable with nose breathing first,
yes,
and
yes,
then be able to hold your breath
I like
without the fear. Like parang if you tape your mouth at night, it's like you're being kidnapped and you can't breathe. It can cause fear, it can
yeah.
cause anxiety. So definitely you have to, ease your way into that.
Probably that will be good if especially if you have a splint, right? If you have position your jaw on the proper position and then you tape it so everything is locked, probably it works.
Yeah. Oh, I did that last night for the first time. I'm gonna observe how it is for the next no 6 days and
Because you have something to hold your jaw, not to drop. You have the
yeah.
splint or not the appliance, and then yeah, I would try that to some of my patient with appliance. Like you need to sell it with
Yeah.
appliance, okay?
With an appliance, yeah. What are some of your successful cases? Like if you could name some of the amazing cases that you've had that wow, changed their lives, whether it's sleeping or mental, performance, whatever.
Trigeminal neuralgia, I have Bell's palsy. We have now encountered that's amazed me a lot is the person with anxiety, agoraphobia now improve,
Wow.
agoraphobia improve,
Agoraphobia.
and yeah, and some anxiety that could be related to airway. What else? A lot of frozen shoulders, a lot of things that are retinopathy, hypertension, their health, immune system. So there are a lot things that are not. Sometimes I look at those part of medical doctors wherein there is no etiology. So I'm thinking it could be dental. That's why they don't see anything wrong in the aspect of medicine. It could be
Yeah.
structural.
Yeah.
Structural, right? Yeah. So we need to see could be something postural issue that we can work with chiropractor because we have this ascending and descending factor that if your it
Right.
is not aligned, it can cause an effect down from from the shoulder to your leg. So it could be postural, could be airway, or another thing for us is well, those are the main reason. It's something to improve the airway and the function, like chewing as well. They have amazing and facial pain is number one. Is that really those trigeminal neuralgia that are being medicated? It's so amazing for us to care straightforward. We can correct them immediately. It's just alignment of the jaw and the teeth. So
Imagine.
especially migraines, really.
Yeah, imagine that, the splint and everything. Yeah, I remember because when we did muscle testing, John muscle tested me for C1 to C7. So the different, yeah.
Yeah,
And then without
another,
the
since you mentioned about the cervical, sorry, Ellie. Since you, I just remember one
cervical
of my
spine.
patient. Yeah, we have a very rare first time for me to encounter cervical dystonia. One of my patient, one attorney Ruth. I hope she doesn't mind mentioning, but she is a believer, and she have a cervical spondylosis and cervical dystonia. Who had just surgery with metal rod here, and he was saying, "Where have you been in my life? You could have you could have I could have worn splint before I did the surgery. Like that's amazing. Like, okay, now I know it's dental. Yeah.
Yeah. That's so cool. That's amazing. And you know what? All of those conditions that you were, well, some of the ones that you mentioned, psychobiologically, we know the root causes based on this other body of work that I'm teaching here in the Philippines called Germanic Healing Knowledge, like, agoraphobia, asthma. We know that these are distressful life experiences. They're being triggered by that. But then it's so interesting how the teeth kind of also adapt to these distressful experiences kind of support the teeth, it also supports the biology as a whole, and the organism feels more supported or reinforced or better. And it has a big effect, overall effect also. So parang to address it, the teeth, and then to address the life situation, of course, and all of that will make you this robust, resilient, anti-fragile human being. And if you don't ever address the teeth, it's like you're missing this huge piece of opportunity to optimize the way you feel in your body. And that I think everyone should really address that, whether you have structural issues, body pain, you have emotional issues or whatever. Look at the teeth, everybody. Look at the teeth and craniodontic
Yeah, that's
sleep airway sleep
yeah, yeah.
dental sleep
And
medicine
of course, the emotional, they should go to you. But because we have some patient also, I think this is not teeth. I think this is a patient of Ellie. This is so they are also partly. That's why as a dentist, you should know it's not about placing a simple splint. You should know the root cause. Sometimes it could be emotional, could be
Yes.
trauma, could be stress. So the splint doesn't work. The dent, even if you're going to correct the teeth, if the brain is focused on the trauma and emotion itself, then the dentist will fail. So you need to
Yeah.
really analyze what's the root cause and what's the focus of the brain. Is it the TMJ? Is it the teeth? Or is it the trauma? What the brain prioritize first? So that's the thing that we need to see because it's not all
Right.
dentistry. Yeah, it's not all dentistry.
Yeah. The holistic
Yeah.
lens talaga, no,
Mhm.
doktora. It has to be holistic, eh.
Yeah.
Oo, but I just feel when I think about dentists in the Philippines, there's nothing holistic about how they approach the biology,
Yeah. Yeah. Yeah.
the human
Before.
being,
Yeah.
except for
Yeah.
you.
Before.
Yeah.
Yeah. Yeah. Me too, as a dentist, like I never thought being dentist is knowing the biology and physiology and biomechanics of. I thought it's all about the teeth. Now you need
Amazing.
to know a lot. Yeah.
And I'm so happy that you're here in the Philippines, that you're the one who actually pioneered it here, or you're teaching,
I-
you're the
It's
instructor.
it's God's plan. Probably God knows that as a Filipino, they need us because of the budget, especially people who are in the province, right? The body heals. That's my point. When I was in the province, like we don't have the money to go to the hospital. Why don't we preserve our teeth? If we can do something, we
Yeah.
can even make a denture that is so cheap. So it can help you in your immune system and wellness. You can make your life 10 years longer. Why not, right? So that
Thank
is
you so much, Doc.
thrilling.
Thank
Thank
you.
you so much, Ellie.
Yeah, you're welcome. What's something that anybody can do that's doesn't require much money or whatever, that they can do for themselves to improve their airway and their sleep?
Well, they should improve their function, especially chewing. There's a purpose of if we have a machine that record chewing because you're talking about enzyme. You need to chew. You need to place your tongue up. So you need to chewing can develop the bone. It can align the teeth. You place the tongue up, so everything will work together. Yeah, not much, right? That's the technique of mewing. Just place the tongue up, chew properly, and that's it.
Yeah, so chew it until it's liquefied na. So a lot of to count to chew.
That's why in young children we need to really in even in growing like my apple 5 years old. So we do not recommend doing a straw using a straw
Yeah, okay.
because it
Oo.
ruin the lip muscle, so it can so dapat naka-glass na yan. So you encourage I think Jan did mention about the my grandson, you need to develop the chewing, so the maturation of chewing transition
Yes.
from baby food to maturity, so you need to develop the chewing. So that is the most cheapest way. Or I was
Right.
mentioning about if a mother in the womb, so you need to do the proper diet. Sometimes kasi they're dieting, so dun pa lang dun ka makakatipid if you have a proper, especially the work of Western price, the proper food, the work of Western price.
Yes, the book.
Most
Yeah.
yeah, so it doesn't happen only on the indigenous people. You can adapt to that diet as well.
Exactly. Thank you so much. Doctor, can you let us know courses that people can sign up to, whether dentist lang ba ang pwede, or
Oh yeah,
do you teach about
right.
what
Yeah,
we talked
well,
about here?
oh, you have the biohacking, your podcast really good for us to educate people, patient, dentists as well. But I teach for those dentists who want to study a more holistic way. I teach functional dentistry, wherein we are focused on occlusion, chewing, not only TMJ. I used to use the TMJ aspect because dentists are to TMJ, but actually to be to be really realistic about it, it's about functional and aesthetic adapts and an occlusion for you to improve the chewing of your patient, their swallowing, and their speech as well, and to have more predictability, more functional creation when you do your aesthetic, your veneers, your crowns. So you need to consider the airway and also to stimulate the well we go with the osteopathic, you stimulate that system, the biology of the system, not to really be the cause of the problem, need to not to be the cause, right? We can help the patient. So I teach. So if you want to join us, we have Craniodontic. So we are posting our group, Eillen Manalang Facebook. So you can see in some seminars as well, like veneering and crowns, that we really are very particular in doing that because we do not want to destroy the function. So be careful and be really careful with the seminars that we attend. Sorry. Yeah, something that is more holistic and something that is more fulfilling when we do our dentistry. It's really benefit. Well, I benefited from that. So I'm now sharing it with everyone.
Nice. Doctor, you also do braces, right? And I did, okay, Doctor, you're gonna be, I did Invisalign for 10 years. And it's really, it's not, I would say,
Okay.
I should have invested. I've known you. I wish I knew you instead of,
Oh, we're
doing it.
talking
But
about Invisalign braces, yeah. So when we do braces, it's more on we do braces, but we align with osteopathic technique. So
right.
the conventional or ortho, that's why when I talk to dentists, like the ortho is not the same with us. We use their technique, but we also align our technique with osteopathic.
Right.
So when we use wires, we don't do the conventional sequence of wires because we consider that the head should not be hold. So we are very particular with the type of wires we're using, and we are very particular if the patient's having migraine because of my wire. So because dentists won't be aware of that, and they might say that the patient is just like inerte, I have migraine now, and then sometimes the migraine is caused by the wire because it's so
Wow.
thick or so it doesn't move. Yeah, it could be even the aligners itself could have did experience that can hold your cranium not to have that rhythm. So we
Yeah.
need to be very particular with that. Those are technique in dentistry. Sometimes we need to also use that, but well, we need to be careful. Actually, dentists should be
Yeah.
aware of the things we're placing in the mouth. Yeah, we do
I love
ortho, but
that.
in an osteopathic
Yeah.
way. Yeah.
Fantastic. Best way. I'm so glad that came out that we talked about that. That's so important. I bet you the other ones don't really look at that or don't really consider those options that you just said.
Yeah, that's normal for them because as say you need to have a training osteopathic for you to believe because I've seen how osteopathic really works when you maneuver the skull and then the migraine is instantly gone. It's just a light. The maneuvering osteopathics like light as feather, like and then the migraine was gone. Like what did you do? It's just a light, but it
Ye-
works.
We we didn't explain actually osteopathic or
Ah,
craniosacral. Doctora, can we just give a brief description of the practice?
yeah. Osteopathic is about the practitioner who do cranial release. We call it cranial release, wherein they're releasing some cranial suture tension or there's a strain. As a dentist, how do we apply it? Because sometimes when we have malocclusion, the teeth are not aligned, the gear are not aligned. Since we have the occlusion, we have this contact points, and those are so heavy. It costs 250 kilogram of force, and those trajectory of forces that should be trajecting in a line perpendicular. We are crisscrossing like this, so it can cause some force vector that can jam the suture of the head. And as a dentist, we do manipulation of the skull before I do that, and then it's amazing that their pain is like you're like a doctor, like what did you do? You ever so we just release the suture and it works. But now I don't do that anymore. I refer them to osteopath. What I do now is to align the teeth because if I align the teeth, all those force vector that are zigzagging now traject normally to the skull, and we have 250 kilogram of force. And if your teeth are aligned and with your jaw eccentric, it can enhance the cranial motion um, that can circulate the cerebrospinal fluid of your head that can give some nutrient to your brain and immune system and so on for the osteopath. But as a dentist, it's a simple technique: align the teeth and everything will be okay. Unless there are some stress or trauma, then you refer it to tele or to the osteopath because there are some issues that are not dental. So boy, yes, a lot, yeah.
Holistic lens talaga kailangan, no? Yeah,
Yeah.
amazing. And we can ask the body, is it dental? Is it emotional?
Yes,
Is
you
it
can ask
love?
somebody. Yeah, like sometimes as a dentist, like I do not know what to do, but I have a technique like applied kinesiology. Since I do not know what to do to this patient, I rather ask the patient, "What do you want? Is it dental? Is it posture? Is it Ellie? Is it trauma? Is it?" I don't know. I'm a dentist, right? So I rather ask the body of the patient, but not vocally because they find it me weird. And just doing applied kinesiology. Don't mind me.
Oh, better not vocally also, Doctora, para they don't manipulate the answer. Kasi
Yes,
they hear the
yes, yes.
question, they might, answer
Actually,
it.
now, my student right now, like I was talking that I might be speaking in the podcast of Ellie. I do frequency. I do auras. I do. I can balance the aura. I can feel your frequency from way from your room. Like at the end of the room, I can feel your energy. But I'm not talking about that to my class. Like, but sige, how are you a quack doctor? So, I study osteopathy. I know frequency. That's why well, some of my students might be hearing me now. When I choose my patient, more patient in my work, I'm actually doing frequency. Like who will be my guinea pig now? So they like, how do you know I'll be a pain patient? Because I never tell them that I'm doing frequency. I'm doing scanning, but I never mention about it. You know that, Ellie, that you can feel those patients who want
Oo,
the most,
don't
needed help. You can
need
scan.
you.
Like,
Yes, exactly.
they were wondering, do you have the gift of healing? Like, no, I'm just doing scanning.
But
Yeah.
it's so funny because our heritage, we're largely using energy work, and everything is energy. I mean, it's electromagnetic if you want to go
Yeah.
quantum
Yeah.
biology. It's electromagnetic spectrum. It's the energy. Heat is energy. We cook
Yeah.
with the heat. There's cold and there's water and there's all the elements. It's all energy. It's so funny that people, and our nervous systems kasi we evolved to connect with each other. It's called interoception, which is that like this pre-thought ability to understand, to vet an area if it's safe or not without even thinking. You already
Yeah.
feel it.
Yeah. True.
You already feel it. Like if you see a person who doesn't feel safe or whatever, you don't even have to muscle test. You already know I'm not safe here with this guy, with this person or woman, man or woman. So parang that's our sixth sense. We
Actually, in dent, probably some of the
Mhm.
dentists now listening to us, they can tell the story. When we have this, all of the dentists that have this experience, I can always tell them, when you have this instinct, like that is your last patient for today, and then she's asking for extraction, and then you extract, but you have the feeling, I should not extract this patient. Feeling ko hindi ko extract ito eh. Feeling ko lang. And then you extracted it, and then there's a problem like bleeding or ankylosing. Like, sinabi ko na nga ba, I could not have touched. That's the thing, right? Every dentist have that experience. Sinabi ko na nga bang hindi ko na dapat hinawakan ito, binunutan ko pa. Now I have a problem. Told ya.
Intuition, intuition.
Intuition, right? I keep on telling my student, like, you have that, right? You have that intuition and you should listen to it.
Yeah,
They have
yeah,
that experience always.
yeah.
Dentists have
And
that experience.
and I think the dentist of all should be the most compassionate and the most heart-centered or the most heart-resonant because a lot of the trauma of patients are in the dentist chair because
Oh,
they're so afraid of the dentist. You know, it's quite a sensitive area, diba?
it's amazing you talk about that because in craniosacral, I did the somato emotional release training, and
Yeah,
like what I've said a while ago, the mouth is expression, avenue of expression. So
yeah,
I've been warning Jan. We were talking about that earlier when you visit our clinic. As a guy,
yeah,
I've told my son, you need to ask the body of your patient that you're going to do an
yeah.
impression. You are actually asking permission, even the patient doesn't care, but you are talking to the body of your patient that I need to do some impression, so I need to go inside the mouth. Because like what you're saying, because you are trauma counseling, right, Ellie? So
Yeah.
there are some patient of us dentists who are listening right now, especially guy dentists. You are not aware sometimes your patient is sexually abused or traumatic, so something.
Yeah.
So we need to be careful and you need to verbally
Yeah.
ask your patient to ask permission before you do something in the mouth. You might trigger the trauma. Am I correct, Elise? Yeah.
Yes,
We were trained to do that, and we need to ask permission. Like everything you do in the mouth, you need to talk to your patient and ask permission. You start from the youngest to the other, you need to ask permission. Yeah, it can really cause
absolutely.
trauma. And
Yeah.
you need to be careful as a dentist.
And then if the body says no, is to honor that. To honor
Yes.
that. Yeah. As a trauma therapist, when we do it, we always ask permission. If they say no, it's a no. Not
Mm.
today. Forget. Don't do it.
Oh,
Yeah.
yeah.
There's another work. I don't know if your dentist and also yourself, Doctora, can consider it. It's something called neural organizational technique. And that's actually where I found out that a lot of the patient's trauma talaga is in the chair. Have
Dental
to
care.
Oh, the dental chair, the actual procedure, actual being worked on in the dental chair.
Most of the traumas goes in the dental chair.
The physical trauma section, but there is a
Not
lot
yeah,
of sport trauma out of the
yeah, yeah.
experience. Yeah.
And how many
Out
percent
of
is that? Talking
I'm
from
not sure the percentage. This particular work kasi it uses applied kinesiology. So it uses muscle testing to
Mhm.
ask the body where are you misaligned. Parang ganyan. Kasi neural organizational technique,
Oh,
there's a self-writing mechanism that the body,
okay.
the nervous system has, no? Because of course, this phonoid is connected to the sacrum, the occipital nerve is
Occipital is corrected to the
parang
same.
ganyan, pelvis or whatever. Yeah. So the body can write it itself
Yeah, yeah,
with the
yeah.
proper tool. proper communication.
Yeah.
It's called real organizational technique.
Mutual
So, so
organization.
the level two of that is actually the jaw and digestive system.
Oh, yeah.
Manipulate the pterygoid, the
That's,
buccinator,
oh, really? The muscle of mastication. Oh.
mastication. And then there is a particular thing we muscle test is, did you have the trauma when your eyes were closed or eyes were open? Was it
Oh,
light or was it in the dark? And the body
that's why we do tests. I
stores
have
this
applied
information.
kinesiology with dark. As I learned autonomic nervous system, but it's applied kinesiology when we test the patient from black and white,
Yeah.
and then we do applied
So
kinesiology.
baka something like that. So eyes open, eyes closed, in the dark, eyes open. Or like, did you have an accident at night where were your eyes closed when you were bumped? Or could it be in the birth canal when your eyes, things like that, that the body is storing and
Mm.
this all of this information, and then you use that to for the body to write itself. It's the most amazing work. So I feel that your work, this work, and the trauma work will really like help people, jump to the next level evolution. I think if we start to harness the body self regenerating, self balancing,
Regeneration.
self organizational mechanism,
Yeah.
diba? Autopoiesis. So amazing.
A lot of things to learn.
There's so
So I'm
much.
so
Yeah.
interested. I'm listening to you like, wow.
I wanna bring a
Ah,
practitioner here, Doctora, from Australia, kung
yeah.
puwede, and then we'll see how we can work together or build something in the Philippines so that people will come here for our work.
Yes, yes.
Diba?
Yeah, we have the right bite, we have the right calibration that work with applied kinesiology. And
Yeah.
yeah, I did, and we call it autonomic nervous system, wherein some patient who have the do not have the right bite, they are always in sympathetic mode. They are in
Yeah.
sympathetic dystrophy, and then when we place a splint, they go into parasympathetic mode.
Wow.
That's correct bite. When we place a splint and we can test, they automatically go to parasympathetic mode.
Wow.
That's really, but that was taught by Dr. Steven almost. So, but for me, like it's too much for me, like too much brain cells. Like okay, but it works. Yeah, it's a lot of things. Like it's amazing. It's amazing to learn the make
Yeah.
rich, and it's amazing to talk to you guys. Like in biohacking, we are not alone. Not anymore, right? This your group is
Oh,
international. You have how many members?
12,000 or 13,000?
12,000 around the world. Did you hear
Yeah,
that,
yeah.
guys? Did you hear that? 12,000 international. Who's doing applied kinesiology? And what are we doing, guys? My goodness, apply it. Yes,
Ay naku, we need more of you, Doctor, because you're always so busy, you and John, so that we can have, you in a more, relaxed.
siguro probably next podcast if you want to with those guys, like I want to listen to them with their work.
Yeah, that would be nice. Yeah, thank you. Doctora, where can people reach you? What are your office hours, your clinic
Oh,
locations, and all of that, and
thank
social media?
so you can research me in social media, Eillen Manalang, and also we have our clinic in Green Hills in Annapolis. Annapolis we have it, and also in Tarlac. So just research Manalang Dental Group. So we have the branch in Tarlac and in Green Hills. Yes,
Nice.
Annapolis Street. I don't know the address, right? But you can research Manalang Dental Group.
It's near Shopsville. Basta it's near the
Yeah.
area, diba? And then, Doctor, you're always in the Green Hills branch.
I'm always in the Green Hills branch. I'm there Monday and Saturday, and today I'm there and Tuesday. I'm almost there. My house is few blocks away, right? And in Tarlac, I go there once for now, once a week.
Once a week.
Yeah.
Okay. And your son, Dr. John Manalang, is
If
in
I'm not
Tarlac.
there, my son is there. So
Very
if I'm not
right.
here in Green, he will be here. We have a lot of associates who are trained on this concept. And our clinic is focused on wellness and where airway and function and dental sleep. So all of my dentists are trained to do that. So you're safe. So when you go there for ortho, any procedure, they always consider that because that is our priority. And you're safe.
Yeah.
Don't worry about them. Yeah, we focus on that.
Super safe. Biohacker approved.
Thanks
Number one
so much.
choice.
Yeah, thank you so much.
Yeah. Thank you so much, Doctora. And thank you so much, everybody, for listening. This is on replay, and we're going to produce this for the Unlimited PH channel as well as the Biohacking and Beyond podcast, audio only.
Thank you so much.
Okay. So thank you so much for sharing your wisdom. Bye, everybody.
Bye,
Have a good
everyone.
night. Till the
Bye.
next one.
Thank you, Ellie. Thank you, guys.
Bye-bye. Thank
Bye.
you.